Hi, good morning, everyone. I hope you are still awake at the meat of this, this summit. So, thank you, Vishnu, for your kind introduction. And today, I'm very delighted to be here to be partner for Medic Footprints, because I think this is a great platform for all of us. You see, I would like to share with you what I have been through. And hope all of these you can take home and learn and to decide what is your next career. Also, I want to take a note of appreciation to Dr. Zuhair. I think the starting of this speech is from him, the doctors who can code. And now I'll be talking about diversifying your career in digital health tech. And I'd like to introduce you, this is my team. I wouldn't be here without my founding members, the team that I have at the back, from Dr. Gopi, the business development. We have Dr. Jason, the clinical operations, Dr. Lee, our corporate affairs, our CTO, Kapi, who codes, but he's not a doctor, but he's brilliant mind with IT lingos, you see, and our chief pharmacist, Morgan. So let me give you a story. I know everyone of our previous speakers, gave stories. I'll just listen to my stories a little bit here and there. I'm Karen. People back in hospital call me Koay, Dr. Koay. Koay Mui without the sound of H. That's how they always remember my name. And I've seen here all of you are very young, and I've seen some of our colleagues back there, in HKL. So I graduated from Unistim layer more than 10 years ago. If I took a quote from East just now, Dr. East, is to know yourself. I'm from a kampong town, a very rebellious firstborn, always want to try new things, adventurous. Just now, Dr. Shamila talked about Indian family wants Indian doctors, right? In the family, Chinese. You get, good results. Doctor lah, lawyer lah, jadi doctor, all my jadi doctor. So, from matriculation, I was fortunate enough to enter local matriculations. Then I went to Unistim layer. The 5 years, I'm not the typical local medical student who sit and exams, papers and all. I'm a very sports person. I joined athletics, I joined basketball, I joined this and joined that. My greatest achievement back then, I represented as 110 hurdles runner, and I got second spot next to the national athletes. So that was my achievement. And after that, I did not stop, just to let you know, when my friends, 3 months after, that back then, the queue wasn't that long. After we passed, we waited for 3 months, then we entered housemanship. So I said, 3 months, I still have not enough. So I delayed. So guess what? I joined pageant. I went to interview, I joined pageant, I did a lot of networking back then, So my character is like that. So this is how I understand about myself. So 2 years, probably 6 months after I graduated, I started my housemanship in Hospital Kuala Lumpur. That 2 years, from a person who don't drink, put to a person who drink, we have a lot of friends, until now, we still go out, having drinks and all. So that 2 years I finished, I was a floating medical officer in ophthalmology department. I was the first MO that floats in that department, because at that time, the start of influx of many doctors. I was privileged enough to have my first year in on-call system and second year in shift system. So I enjoyed both worlds, you see. So after, this character of me, in floating MO, start to do something a bit out of the box. I took a career shift. I said, I want to go to Singapore. Back then, MBBS able to, go to Singapore to practice. I was offered to be in ED in Changi Hospital. Okay, but something happened, for some reasons. I think Dr. Isha mentioned I actually had a personal change in my life. I met my husband, I have kids, everything happened at once. Took a career break for 2 years. Okay, that 2 years I did not do any clinical work. I went into, because back then when you already resigned from government, you cannot turn back. Some of you may know back then we have contract MOs. JPA actually offered contract MOs, but then they stopped this application. And then I was running around searching for a job because I haven't completed my compulsory service. That time, you make that kind of decision. So you want to go back. It was very, very tough. So from medical, scientific liaison, I searched for jobs, research. And in the end, I got a job as a sales and marketing manager for a local medical device company. So I closed, my, probably it's because of my interpersonal skills, I managed to do some sealed businesses with some local hospitals that actually advanced my networking skills. So after that, I back to clinical in IJN, okay, in 2015, where I was the medical officer in emergency department for 3 years. Like all of you also, you are out of the system. Okay, at least for me that time, out of the system. I can't join clinical masters anymore. What should I do? Aesthetics, I took it. Dermatology, I took it. Everything. I tried everything to find the correct, cup of tea for myself. So at that time, we was quite lucky that IJN actually offered a new doctors in management, where they actually offered doctors, they always like in the front gear of, to try something new. They offered us to try in the management healthcare operations. So I was in IJN Private. That was a new entity under IJN. So can all of you tell me, IJN is a private hospital or a government hospital? Okay, the answer is private. Okay, so I can tell you briefly, just give me 1 minute so you will have a brief idea. How do you admit to IJN? So IJN St. John Berhad is actually a government lane where you only can enter if, let's say, you are referred, from government hospital, which is the big government hospitals, let's say Hospital Sedang, Ipoh, then these are called subsidized lane. Other than that, if let's say you're a pensioner, you are state government, local authorities, you have proper referral letter, then you can enter IJN. So then, IJN Private is a sector where cash paying, insurance, GL, and international patients will go to IJN Private, but it's a paid. So that's the difference. So I was in IJN Private as their doctor in management, business development, giving talks to corporate companies, building some new services. I was very honored to actually establish the first vascular unit for IJN Private and IJN as a whole. So 3 years down the road, my mentor said, okay, you have enough of, experience in human resource. You have enough, go and take MBA. So I took my MBA in University Malaya. So this all actually, I felt one quote that I want to pass to you all is, education is never ending. You have to equip yourself, try to find new things that suitable to you. And probably I know myself very well. I love to meet people, so that is why I like to challenge and be adventurous. So that is the key point that I want to let you know. So, late last year, remember the friends, we started something adventurous, but COVID started. People scared to come out from hospital to clinics and all. So we started to gather few, networks and all. We started to do home PCRs. Okay, so so I was among them, appointed as the CEO. Okay, although I already out from clinical services, but I still do house call because we are the few people that actually started this, you see. So we do house calls, we still do medical services and advices to our family and friends, like all of you. You might be 1 or 2 doctors that is actually in your family. So you are their family doctors. So the concept is still the same. So like education whatsoever, right? You cannot take away the doctor inside you no matter where you are. So I consider myself as a mompreneur. I'm a mother with 3 kids. So I'm considering myself a mompreneur, like other people, could be a coder, could be management, could be any business owners, and what you want to do something new in your life. I think you cannot take the doctor away. That skill is still within you. All right. So take home to all the doctors here today. Equip yourself, with skills, experiences. Learn more, take courses like what I did, for the past, let's say 6 to 8, 7 years to find yourself what you like to do. So as a CEO, I'm not a born leader. It's not an easy task as dealing with patients. You have sick, then I talk to you and all. No, it's not like that. It's about people management, negotiation skills, communication skills. Those things are not really taught in med school. So you have to meet with people, experience it, then you would know. Okay? So enough of my self-introduction. I'll give you a little brief about Nadi. A little bit, then I'll end it with a video. All right? So Nadi aims actually to be a platform, to connect offline to online GPs and healthcare professionals. We aim to be, this is a startup company, all right? We want to be a medical companion to any accessible users. So evolution of health tech is happening. You can't be waiting, to just your brick and mortar in your clinics or in your, medical settings to wait for patients to come to you. Okay? So like how WHO actually, okay, I think there are slides that are missing. Never mind. So from my past experience, COVID actually has made all of us understand medical services is not just in the clinics or hospitals. In the era of COVID, I'm sure some of you will get calls from your friends and family. I get double line, what to do? All these are actually teleconsult still. You are not seeing them, but you give your advice. Correct or not? So these are actually some of it. But the digital type means we actually make it into automation, to an app for easy accessibility. All right. So the evolution of health tech technology is not only on the app, on devices, from X-ray, prosthetics, pacemakers, everything actually improve the life of people. All right. So for tech as well, I think we have some partners today, Doc2Us, QMed, all of them, we are actually entrepreneurs who wants to change life of the people surrounding us. Okay. So, basically, the role of Nadi is to create an offline to online GP connections. We want to have doctors to come on board, to actually give their services beyond the clinical practices. So from online consultations, from app, then we have this concierge service. So during COVID pandemic, we actually provide home medical services to do PCRs. And from there, we actually evolve from these customers to actually continue their chronic care management at home. You can check out our booth. How did we actually do home visit kits, where it's actually using technology such as ECG. It's a 2-finger mobile ECG that provides all these instant and personalized healthcare, services. So sickness may not knocking at your door right now, but you will never know when a disaster strikes. I would like to take this quote to let all of us understand is that evolution such as insurtech, fintech, proptech, you can name food tech, is happening. So health tech also, So it's how we're going to manage and leverage it to actually to ease the use for our users. So actually there are some slides that not really, okay. So that's our objective. So we're going to be the platforms to connect the GPs and doctors on board. And these are the services that basically we offer, at the moment. No doubt our app is not ready yet, but we have our online services. Soon we're going to release and we're going to announce it in our social media. All right. So, okay. So if for any medical personnel who wants to join us, you can come to our booth and check it out. But one thing that I would like to enhance or emphasize something beyond Malaysia in terms of health tech. Check out something like Teladoc, Cry, Babylon, Hello Doctor, in overseas, you see, in the west or in the east or in nearby neighboring region like Indonesia, these people are the frontier in healthcare technology. So in Malaysia as well, yes, no doubt there are a lot of regulations, you see, like Telemedicine Act in 1997, So that should not stop us to actually improve and evolve our health service technology. So before I end, I would like to just plug a quote from Hippocrates' Oath, you see. As for diseases, make a habit of two things: to help or at least to do no harm. So this is the principle that we have. Technology is just an assistant to whatever service that we want to provide to our patient. We do not provide harm to our patients. So to end this talk, I would like to show you a video which is a collaboration of Nadi as a platform that connects the GPs and our business partners and organization to provide better service to the community. Thank you.
Years and years ago, they have their own way of treating themselves. Well, they're not. There is a fundamental difference now.
The health accessibility for these needy communities of Orang Asli is limited, from the younger children to adolescents and adults. Most of them are malnourished, have problems such as high blood pressure and lung diseases.
They are mainly malnourished and specifically lacking in protein in their diet. So the children are also underweight for their age and some are stunting. If we do not address this concern soon, it will impair their mental and physical development.
Generally on their own, years and years ago, have no issues with food or their medical health. They have their own way of treating themselves. They are able to survive. There is a fundamental difference now. The jungle they have is becoming smaller and smaller. It's being taken over by the oil palm plantations. So they don't have the necessary resources. Things that we do is give out groceries. We give rice, sugar, salt, biscuits, and basic groceries. These are things that Asli deep in the jungle actually need.
The program meets the demands of certain group that has lower leverage towards healthcare. I'm really appreciative that I could join and be a part of this program. Partnership with Nadi is something which is very intriguing. It's a wonderful digital platform for Nadi, for the GPs, for patients, and better outreach. This will be a good avenue where patients receive the best treatment, and it's a very good placement where they can have your family GPs involved, a personal doctor. Let's give them the best services that we can.
So we hope that working with clinics and Food for Hope can help to educate these people to better take care of themselves as well as their health. So in future, with Nadi, GP clinics, affiliate panels as well as NGOs can work together to serve the needy communities.
Hi everyone, my name is Dr. Crystal and I'm excited to announce an upcoming workshop organized by Medic Footprints Malaysia, which is called Switching Careers for Doctors. How do I know what's right for me? This workshop will be held on the 14th of January 2023 in Klang Valley, where I will be speaking alongside well-known speaker and trainer Captain Arriva. In this workshop, you will learn about how to understand yourselves better and in turn, gain more clarity in finding a career that is right for you, that is aligned with who you are. Here, you will also learn about how to shift into your ideal self and create your desired reality. You will learn about becoming more aware of your fears, doubts, limiting beliefs, and how to overcome them. And lastly, you will learn about goal-setting techniques in order to reach your goals. Who is this workshop for? This workshop is especially for doctors who want to discover their unique self so that they can find a career and ultimately live a life that is aligned with who they truly are. So if you're a doctor and you're feeling stuck or overwhelmed in your current career and you want to venture out into something that is more fulfilling and meaningful, but you don't know what to do, then this workshop is for you. Tickets are now up for grabs, so hurry up and purchase your tickets now because seats are very limited. I'm excited to have you on the workshop and I will see you then.